Hello, everyone, and welcome to Healthcare IT Services Quarterly Performance Review webcast highlighting the results from our recent Healthcare IT Services Benchmark Report. My name is Allison Crawford, and I will be your host for today's session. Over the quarters, we've engaged with our readers to bring deeper clarity into the state of the healthcare IT services market. We've had good questions and discussions as a result of these events, and we're excited to continue to connect with you as our HITS practice grows. Minutes or so, Analyst Joe Walent and Senior Analyst John Caucis will delve into the trends driving the results featured in this quarter's benchmark, followed by a Q&A of the trends and how they'll affect you. Before I pass this over to John and Joe, there are a few logistics I'd like to cover. First, we'll be recording today's session and posting it on our YouTube site, TRI channel. We invite you to visit this channel to watch this presentation or any of the others that we've posted. And we'd like to hear opinions and thoughts on the materials we're presenting. Please send any questions or comments to the Q&A or chat function. Joe will address them at the end of the presentation. Or, if you'd like, set up a client query for more detailed discussion, please reach directly to Joe and John at the end of the webinar and we'll set up the discussion. Third, we'll send out the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You'll also find the slides, as well as our other thought leadership pieces, other webinars, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight. Now I'd like to introduce you to Joe Walent and John Caucis. Analysts have been covering the IT services market for a total of 16 years. John has been analyzing the market for the past 10 years and is TBR's resident expert in the government practice. John's research has been critical in the planning of his clients' black hat strategies. Joe is the HITS lead analyst and has been a linchpin in the program since its initial coverage of CSC. His insight into the performance of the HITS vendors is unparalleled in the industry, as guidance has assisted countless clients with their strategic planning. And with that, let me hand it over to Joe and to John.
Everybody, and thank you, Allison. Before we get started, I'd like to provide some background information regarding our research approach and methodology. We have, on an ongoing basis, 18 vendors in our healthcare IT services practice. On 18, we publish quarterly or semi-annual reports on 12 of the companies. And we publish 5 healthcare IT services company reports focusing on the healthcare IT service businesses of Accenture, CSC, Dell Services, HP Services, and IBM Global Services. We include quantitative and qualitative analysis of 5 additional healthcare-centric firms in the quarterly benchmark report. As vendors are also leading healthcare IT service contractors, TB has included them to provide additional insight into their healthcare IT service market and out our coverage. We have a representative cross-section of the overall IT services arena. So let's begin. The third quarter of 2012 signaled the end to a period of ongoing delays, with the action first around the ruling by the Supreme Court of the United States around constitutionally of the Patient Protection and Affordable Care Act, which was upheld, and the results of the 2012 election, which were seen as a decisive factor in the Affordable Care Act enforcement going forward. We believe those decisions made, the 2013 will be a year of healthcare IT services expansion in the U.S. as well as globally. With it, we'll focus on the 3 major opportunity areas or trends that will continue to be significant forces shaping the healthcare IT services market going forward. The first is the role of electronic health record implementation on healthcare IT services market, the drive to expand big data and analytical capabilities, and the widening role of cloud in delivery of these aspects of services to the healthcare industry. Finally, the modifications and changes players are making to adjust to the demands of the market, especially around providers and payers' need for improved cost controls and efficient delivery. Right in. Electronic health records are one of the main foundations for the expansion of IT services within the healthcare industry in both the U.S. and globally. Accessibility and flexibility of electronic formats for health records allows for the improvement in efficiency and awareness for providers, payers, and state regulatory agencies. The Speak High-Tech Act is part of the American Recovery and Reinvestment Act in 2009 and served as the real launch point for the conversion of healthcare records to an electronic format, with incentive payments from the federal government to those participants from the demonstration of meaningful use of the new records. The second goal of meaningful use now in effect brings expansion of applications to the format, including access by individual patients, and which to complexity and security concerns around the management of the data. Further, the Payer Protection and Affordable Care Act relies heavily on the improvements in data transferability and interoperability that electronic health records provide to improve data flow and to ensure that the use of accountable healthcare organizations is optimized to improve overall population health. And we feel that this is a strong area for providers to move into in the coming quarters. More companies, providers, payers will be looking for that interoperability. Now, I'd like to take a moment to orient you. This indicates the 12 trailing month revenue growth velocity. This indicates the 12 trailing month operating margin. Finally, the size of each of the spheres is determined by the 12 trailing month revenue of each of the healthcare IT service providers that cover in the benchmark. The players experience positive growth and favorable margin performance, indicating the general trend is for consistent demand. One outlier that you'll obviously be drawn to is CSC, which was influenced by the setbacks of their the contract renegotiation with National Health Service in the UK. We expect the impact of those renegotiations and the charges against the previous contract flow off in the coming quarter, and CSC will rejoin the pack. The average of all the companies' growth rate in the health IT services benchmark was 21.7% in the third quarter, with General Dynamics, CG, and SAIC all registering strong revenue expansions owing to recent acquisition activity that expanded their healthcare IT services revenue base. The impact of General Dynamics' acquisition of Bangen will diminish in coming quarters. However, CGI's purchase of Logica and SAIC's purchase of XIT both provide additional healthcare revenues and will serve as foundational evidence for continued growth in the industry sector, and we expect them to lead going forward. TBR observed the companies focusing their services business primarily on the implementation of their own in-house EHR software, leading in the case of margin, case of Cerner and CPSI. We have Indo-centric companies that effectively leverage more advantageous cost structure with leveraging their offshore delivery capabilities, continue to show strong margins in the healthcare space as well. But this business is primarily limited to the payer side and application development and management work. The overall market continued to face delays, as we said earlier, during 3Q12, but in the fourth quarter and into 2013, we expect more investment and to grow more quickly for all players. The aspect of the health record market, we anticipate the coming years will provide continued expansion of the global electronic health record market, with companies such as Accenture, IBM, and CSC well positioned to take advantage of the global expansion. This market is also anticipated to expand over this period, albeit at a rate lower or somewhat lower in the upper single digits. And implementation work will increasingly be supplemented by refresh engagements in 2013 as organizations on the provider side that have adopted wide use of electronic health records and are more familiar with their use and the impact of meaningful use on their requirements will set alternate solutions or expansion or more robust solutions depending on their needs. Provide additional opportunities for the healthcare IT service providers in retrofitting, expanding, or completely re-implementing new electronic health record systems. We anticipate those vendors with some business consulting capabilities will have additions based on EHR implementation, as the use of electronic health records will provide for the restructuring of operational flows, business practices, and allow providers and payers to reduce costs and improve productivity. We'll get into that topic later on. Some examples that we saw went into greater detail here. Accept continues to diversify its healthcare IT services revenue base, catering to customers across the global market. To the close of the third quarter, Accenture announced its win of an engagement to design, develop, implement, and deliver a comprehensive electronic health record system to the nation of Norway. The system will have a record for each of the nation's 5 million citizens at its completion. The comprehensive nature of the project will enable Accenture to further advance its healthcare tools for healthcare demographics, population health, and tracking of physician interactions, diagnostic procedures, and patient interactions, all areas where we're seeing increased demand and interest from agencies, government, federal agencies, and at the provider level. Experts in Europe in the APAC region and Europe, such as Singapore, Australia, need to add to and provide momentum to expand further in the U.S. market. Health will continue to be a lead offering for the firm, and we expect Accenture to become a leader in this regard. HP helped ensure its continued healthcare IT service work with the federal government, as well as state and local governments in the U.S., securing an extension of its long-time contract supporting the Centers for Medicare and Medicaid Services, or CMS. Records and keeping up with data management solutions for the Medicaid system provides HP with intimate working knowledge of what is required to deliver services at the state level as well, and as well as the interoperability requirements that will be needed for healthcare payers, both public and private. We feel HP is well positioned to move into the area where more health information exchanges will need to be developed at the state level, and that there's lack of experience with the Centers for Medicaid and Medicare Services will provide launching point in that regard. As aspects of the Patient Protection and Affordable Care Act are coming into force, the implementation of those health insurance exchanges will be required as well, with many states electing for federal government to provide and manage those exchanges. HP's long-standing engagement with the CMS will also help them win a good portion of those health insurance exchanges work as it comes online, and we're shooting for the October go-live date later this year. Finally, we'll talk about SAIC, the rapid expansion of its capabilities in the electronic health record space by those two strategic acquisitions, first of Vitalized Consulting Services and then recently of Max IT. They've made the company a lead provider in the electronic health record space. Each two integrating them quickly, SAIC was also able to complete and secure an additional $100 million in new business in the EHR space in the third quarter, expanding its overall health IT services practice. These acquired businesses, we expect SAIC to continue in this vein in its healthcare practice as it prepares for its proposed split later this year. Healthcare IT services practice will be a key component of the new business going forward. Expect them to move more aggressively into the space with acquisition activity, as we just said. point would like to go into deeper depth or deep view on is on the huge tidal wave of healthcare-related data that is now available and is being generated and needs to be by healthcare providers, the service, and the government agencies. The identification of regional outbreaks, determining treatments to yield optimal outcomes, and more comprehensive patient histories and data sets have all been rendered a reality in recent years due to technological innovation. The volume of data and how best to leverage it remains a central concern for all facets of the healthcare industry. And those healthcare IT service providers most active in developing those solutions face the greatest opportunity in this market. We feel healthcare IT service vendors that are moving rapidly to expand those capabilities in this functional area will set the bar in terms of realizing return on investment for the information gathering and also for generating value adds for their end clients. In several key areas. The advances in communication technologies have brought us into more frequent contact and offer the increase of access to pertinent information. That information to electronic health records will greatly magnify the volume of data that's available to research physicians and healthcare providers. Again, there's an opportunity for health IT service providers. Especially looking at things like telemedicine, where those frameworks will allow for more frequent patient contact with healthcare providers. Patients in remote areas and with limited mobility will have more patient-physician interaction, and there will be more ability to follow up with outpatients. This will also generate more data that they'll need to be looking at as far as generating positive outcomes for patients. The next piece is the use of smartphones and how ubiquitous it has become in first world nations. It's an opportunity for providers, payers, and government officials as patients to access and update healthcare information on a regular basis. The management of chronic conditions and delivery of warnings of unsafe environmental conditions. Air pollution levels for patients with asthma will increasingly become an expected aspect of healthcare delivery. Those providers, IT service providers that are able to generate solutions for that mobile device management and for the ability to generate and disperse these messages for providers and payers will be on the leading cusp. Finally, real-time information relayed to healthcare providers via the wide use of remote monitoring equipment as accountable healthcare organizations come online will generate additional activity. So what we're seeing is that those companies that are able to pull together the vast amounts of information with data warehousing, data management solutions, as well as strong analytical capabilities, allowing providers, payers, and state agencies, government agencies to generate actual insight off this data will be the ones that are going to be leading the next wave in the health IT services growth. For example, we'll take a look at Deloitte Consulting and a strong move that they made in the space. We said that they're looking at recently purchased Recombitant, which is a data warehousing provider as well as provider of analytical tools. And this is going to allow Deloitte to provide the tools in addition to the expertise and the insight that they have of healthcare IT to render solutions for their clients. And this is going to help them move more quickly into the healthcare IT services space. Likewise, IBM complemented its own ongoing research and development efforts around healthcare analytics, implementing the Watson system that has been primarily and exclusively to healthcare, and delivering more insight, better diagnosis, compiling all the available patient information and comparing that to other data sets of similar populations. IBM made the purchase of Vivissimo and the data solutions provider Texas Memory Solutions has additional tools that they'll be able to roll and package as they are consistently do out to the marketplace. Seeing that this is truly becoming that IBM just is using to generate market demand in the healthcare IT services space. So turn to the third piece. We're looking at the third we'll touch on has to do with the move that healthcare IT vendors are making to better align themselves to demand areas that are developing for provider and payer markets. This is business operation optimization that they're viewing. The overall goal for the healthcare industry and the global market centered on realizing the lowest cost of delivery for the highest quality outcome. IT service vendors are actively moving to enhance their ability to deliver operational expertise to more providers, payers, and government agencies dealing with healthcare. To improved efficiency, eliminating waste, and improving overall outcomes in healthcare will have its capabilities in a IT service provider's toolbox will be a clear differentiator in 2013. We're anticipating the growth of the overall spend in the marketplace to expand in the quarter and 2013. This here shows the IT services versus the healthcare IT services benchmarks that TB has compiled. What here is that in addition to consistently outperforming the more general IT services benchmark, health IT services will respond more quickly to in 2014 with clear double-digit growth as these proceeds. So building out the business expertise and how healthcare IT services can be leveraged to optimize client operations will be a key differentiator in securing new business. Examples of that we're looking at are CSC has leveraged established connections and legacy of work with the insurance sector and is releasing its Payer Optics 360 for use by healthcare payers. The need to gain greater insight into how health plans are being utilized by end users will allow CSC customers, those health plan providers, to more quickly design and bring to market health plans that meet the needs of individuals and wider population segments. We feel that this is a strong offering at this time because with introduction of and more competition that will be generated through health insurance exchanges at the state level, health plans are able to have a clear insight into what's going on with individual health plans, how they're being used, will be given competitive advantage, and therefore CSC will be able to get more and clear insight for their customers. On the side, Dell Services is reshaping its own portfolio with adopting its revenue cycle management business at a time when more companies are looking for this business. Now, they're to a close partner that they've been doing business with for years, so they'll still have access to the business, but it allows them to focus their overall efforts more on developing and implementing clinical solutions on that side, while still retaining access to the overall business operation side of having that kind of deal with services more so than the actual rendering of the BDO in that case. So that takes to the our presentation. As discussed, the demand for electronic health records and associated health information exchanges will remain at the center of demand in the HITS market. We providers will be looking for digitization of healthcare data to drive and the low removal of costs as well, and also use increased business optimization solutions with the changes that they'll have for their business flows. Also, the increased use of analytics in the marketplace will improve outcomes. And in cases, we feel that those health IT service providers that have these tools or developing them or acquiring them will be in leadership positions as the market goes forward. And with that, I'd like to open it up to questions.
We've had a couple questions come in, and I encourage anybody who has any questions based on the presentation that Joe just gave to send them through now. The first question we had is, what regions outside the U.S. offer the most opportunity?
I think that the APAC region, with its developing and emerging economies, and also the South American region, both have a wealth of opportunity with the rise of the middle class in both of those regions and the expectations for expansion of healthcare, improved healthcare in those areas. And they also will be to on the implement of infrastructure. So I expect China, I expect India, the developing economies in the APAC region to be strong growth areas. And I also am looking to South America, especially with Brazil, as a strong growth area. That's to say that Europe and the Middle East won't be solid growth areas as well, but I'm just looking at the on the areas where I think I'm going to see the most rapid growth in action.
Okay. The next question we've had come in, it looks like it's two parts. What impact do you see coming from the multi-billion-dollar effort by the DoD and VA integrated electronic health record effort?
I think that's the biggest impact that I foresee from that is increased standardization of the electronic health record. I think the sheer size and volume that you're going to see from the collected DoD and Veterans Administration integrated electronic health record will put almost an industry standard that has far been lacking, and that's going to reshape a lot of what providers are going to be looking for, and as far as having that improved interoperability that's going to be expected. So having that as a baseline, I think that's going to, or the effort, is truly going to create what's lacking as far as an industry standard in the U.S.
Okay. The next question that came in was, what role do you see open source playing in the healthcare market, especially the VA's VISTA?
That's a very good question. We'll have to follow up. John and I will, put it together and get back to you on that.
Okay. The next question we had came in, impact of the required health insurance exchanges at the state level by October of this year. Well, what will the impact be of the required health insurance exchanges at the state level by October of this year?
Well, I think that's going to be an incredible expansion of the level of federal and state and local spending that we'll see in 2013. They'll definitely be tapping outside our healthcare IT service providers to help them through the process. And I think with a significant amount of the U.S. states electing for the federal government to build their health insurance exchanges by the October deadline, you're going to see a lot more work flowing out of the federal sector to get those up and running and meet that deadline. So I think that it's going to provide a stimulus in the healthcare IT services market, and we're going to see a lot more spend coming that way. But beyond that, there are also are reported shortages of qualified healthcare IT service expertise. So I think that this will serve to compound that problem and drive up costs for IT service providers in that regard, where getting those talent that they'll need with those additional requirements and the certifications will become that much more difficult.
we just had another question come in. Any comments regarding recent research findings that quality and cost benefits of EHRS have been overstated?
That case where there, what I think is happening is that based on the size of the market, there's so many factors that go into these studies. I've seen cases where the EHR provides adequate ROI or cost savings, and on the other side that it's an onerous impact and actually slows down business and increases costs. I think what really needs to be looked at is the scale and the overall benefits that are being realized in a more longer term picture. But I think that the gist is still out as far as exactly what the benefits are and exactly what the cost savings will be in the end.
Okay. This question we have came in. Do you anticipate non-traditional service providers like Oracle entering the analytics space?
I see that there are going to be a lot of non-traditional. I can't speak directly to Oracle, but I know that in companies that would be a natural progression in many regards for a company like Oracle. I also know that the network providers or network service providers are moving into, as far as healthcare network analytics and things of that nature, as far as with that rising expansion or the expansion of data that is flowing around healthcare, that the need for analytics is that much broader, and that it's going to apply to networks, it's going to apply to at database level. So I don't think that that's a far-fetched conclusion to come to, that we're going to see more people, non-traditional entrance into the analytical space.
Okay, question that came in. Any comments regarding Dell's recent announcement that is going private? What are the implications for its healthcare business?
Well, I think that, speculating on Dell's going private and how it will affect the healthcare business, I think that from where I sit, I think that the healthcare business will be a central aspect of their solutions business going forward. It's something that they've been actively growing, that they've been putting a lot of effort into, and I think that, as part of any trial, should that come to pass, care IT services would certainly be a central pillar in what their solutions-based strategic direction that they're taking, and that they're definitely going to continue investment and expansion of their capabilities in that area.
Next question that came in, Joe. Are we going to see an increase in cloud adoption with the BI analytics offerings, or are these mutually exclusive from each other?
The cloud offerings will enable additional BI analytics offerings. I think so. In that regard, I would say that they will go hand in hand. There'll be a lot of crossover, and that there's going to be, the cloud is being rolled out in the healthcare space, and how it's going to provide those scalable capabilities as far as, with data and having data storage and accessibility, having an analytical layer and a BI layer sitting on top or integrated within an overall cloud solution is definitely something that I think we'll see more of going forward.
Okay, final question come in. Do you anticipate increased consolidation in the healthcare IT services industry in 2013?
I think that's almost it's definitely something that we're going to see. I was going to say a foregone conclusion, but I think it is certainly an area that I think EHR will serve to bring about. I think that sheer number of providers and the demand. We're going to see, and back to our earlier discussion of, or the question about the DoD and the Veteran Administration, I think great standardization of the electronic health record will lead to consolidation of those vendors, and I think that also healthcare IT vendors, more and more players are moving into this space, and they're going to be looking to build up their own in-house capabilities, and that's going to further for consolidation in the space. And John, comment?
Yes, I'd like to add to what Joe just said. I agree that there's going to be an increase in consolidation and merger and acquisition activity in the IT space. If for no other reason, or if beyond the reasons that Joe just cited, because when we look at, for example, the IT services space, where some players there turning increasingly, and have been for the last couple of years, turning to the health IT services market, both on the government side and to some extent on the commercial side, as an opportunity for them to deflect the ongoing pressures that they're finding in the certainly on the defense intelligence spaces, but also to some extent in the federal civilian side and in the state and local market. So, we've seen General Dynamics, for example, purchasing Vision over the last 2 years. We've seen a number of acquisitions, and we'll be discussing these in our upcoming public sector webinar in a couple of weeks. A number of healthcare-related acquisitions by the public sector and government IT services firms that we follow over the last quarter, and certainly during the course of 2012. And there's no doubt in our minds that that trend is going to continue and likely accelerate in 2013.
There haven't been any other questions that came in, so with that, I think we'll wrap up the presentation. I want to thank you both for your time and your discussion, and thanks everyone for sending in your questions. I'm going to encourage you to follow Joe and John and TBR on Twitter with the handles listed here, as well as give you the URL for SlideShare in case you want to download the slide or slide from any of our other presentations. Leaving the webinar, we are fielding a short survey, just 3 quick questions about the quality of the presentation and the presenters, and we could really appreciate your feedback on that. We're always trying to improve and do better for our clients. I'm going to the chat function open for another 5 minutes or so in case there's any last-minute follow-ups that you have. Otherwise, we look forward to speaking with you all again next quarter. Have a good afternoon, everyone.